Good evening, guys. Now I have discussion D for you, and this one is the last one of the night. Today we're discussing Advantage healthcare plans denied 70% of long-term care prior authorizations. Okay, so we're going to discuss that for tonight. For tonight's discussion D. Here we go. Federal investigators found major Medicare Advantage plans denied more than 70% of long-term care prior authorizations requests, leaving some families on the hook for bills as high as $49,000. A recent Inspector General review shows Medicare Advantage insurers routinely deny requests for post-hospital long-term care and rehabilitation, with United Healthcare, CVS Health, and Aetna and Humana among the highest denial rates. Families have reported out-of-pocket liabilities reaching about $49,000 when care was unpaid. Denial rate. The review found over 70% of long-term care prior authorization requests submitted to large Medicare Advantage plans were denied. Plans named the highest denial rates were reported for United Healthcare, CVS Health, Aetna, and Humana. Consequences for families. When denial stood, families sometimes had to pay tens of thousands of dollars for rehabilitation or skilled nursing services. Figures cited include bills up to $49,000. Broader pattern. Independent reporting and federal summaries indicate this is part of a wider trend of private payers denying higher cost post-acute services, which can delay care and shift cost to patients and providers. Why this matters: access and outcomes. Prior authorization denials for post-hospital rehab or skilled nursing can delay needed care, increasing the risk of complications and readmission. Delays in post-acute care are linked to worse recovery outcomes. Financial risk. Medicare Advantage enrollees may assume unexpected financial liability when plans deny coverage for services that would otherwise be covered under traditional Medicare, or that families reasonably expected to be paid. 49,000 is an example of the scale of exposure, systematic burden. Hospitals and providers spend substantial resources appealing denials. Many denials are later overturned, but only after time consuming appeals. Practical steps for families facing a denial. Request a written denial and the clinical rationale immediately. Use that documentation for appeals. File an internal appeal with the plan promptly, then request an external review. The internal appeal fails federal rules. Give enrollees appeal rights. Ask the provider to help with medical records and peer-to-peer reviews. Hospital and rehab facilities often assist with appeals. Contact your state health insurance assistance program or a patient advocacy group for free help. Navigating appeals and understanding liability. Key reporting in the federal review summarized above provide the basis for these findings and recommendations for the Medicare Advantage and other private payers are driving a large costly denial problem. Hospitals spend about $19.7 billion in 2022 fighting denials. Roughly 15% of private payer claims are initially denied, and more than half of those denials are later overturned, creating a system 20 billion scale burden on providers and patients. Key facts and scale. Estimated annual provider costs. Hospitals and health systems spent about $19.7 billion in 2022 contesting denied claims. Denial frequency, roughly 15% of claims to private payers are initially denied. Medicare Advantage denial rate average 15.7%. The Premier Survey overturns and wastes. 54.3% of denials were ultimately overturned, but providers still incurred the administrative costs. Premier estimated 10.6 billion was wasted. Pursuing denials that were later paid. Why this matters now. Higher cost services are targeted. Denials are concentrated on expensive treatments. Average denial tied to changes around 14,000, which amplifies financial and clinical risk. Patient impact. Denials and prior authorization hurdles delay care, increase readmission risk, and can shift large out-of-pocket liabilities to families when appeals fail or are delayed. How hospitals and families can confront the problem. For hospitals and revenue cycle leaders, invest in denial prevention, analysis, use data to flag high-risk payers, codes, and clinicians so claims are corrected before submission. Standardize prior authorization workflows. Centralize documentation, peer-to-peer processes, and real-time checks to reduce preventable denials. Track overturn rates by payer. Prioritize appeals where overturn likelihood and dollar value justified the effort. Advocate collectively. Join state and national coalitions. AHA Premier to press CMS and legislator for transparency and reinforcement. Enforcement. For patients and families, get denials in writing and document timelines. Use written denials to trigger internal and external appeals. Ask providers to appeal support. Hospitals and clinicians can supply records and peer-to-peer reviews that materially increase overturn chances. Use free resources. Contact your state health insurance assistance program for patient advocates for help with appeals and understanding liability, risks and trade-offs, administrative cost versus recovery. Appeals consume staff time and money. Some denials are overturned, but only after multiple rounds, so smaller claims may not be worth pursuing. Policy lag, regulatory fixes take time. Short term mitigation depends on operational improvements and targeted advocacy. Okay, guys, that is your shows for tonight. I will be on tomorrow for shows. Until then, Gator Wellness. Take care, folks.